Okay, nurses, nursing students, future NPs, and busy moms, if you've ever been sitting in class, listening to a lecture, reading a textbook, or reading through your patient chart, thinking, what the heck is going on? Can somebody explain this to me in normal words? You're my kind of person, and you're in the right place. Hi, I'm Sabrina. I'm a registered nurse with over 10 years of nursing experience and 20 years of medical experience combined, and I recently became a board-certified nurse practitioner. And probably most importantly around here, I'm a mom. I created this page because there's something you need to know about me. I love explaining complicated things in very simple terms because that's how I learned too. You can give me the long medical definition with all the big words, and yes, we need to know the terminology, but first tell me what's actually happening. Give me the big picture, tell me why it's happening, and then everything else starts connecting. That's how my brain learns best, and over the years, that's become the way I explain things to other people too. It's also how I like to explain things to my patients, because imagine telling a patient your ejection fraction is reduced due to impaired left ventricular systolic function. Okay, but what does that actually mean to the person sitting in front of you? Sometimes I'd rather start by saying your heart is a pump. Right now, that pump is not squeezing as strongly as it should, so it can't push blood forward as effectively. Now we have something we can understand. Then we could build on it. That's how we're going to learn here. Simple first, medical terminology second. Then we connect everything together, because I believe when you truly understand what's happening instead of memorizing words, the information becomes much easier to remember and also to apply. And that's especially important in nursing. I don't want you to just memorize heart failure equals edema. I want you to understand why your patient's having that edema, why they're short of breath, why we're giving that medication, why we're checking these labs, why the providers are ordering these tests, and most importantly, what are you as the nurse supposed to be watching for? Because when all those pieces start connecting, nursing starts to make so much more sense. And that's what we're doing on this page. We're going to break down disease processes like heart failure, diabetes, sepsis, kidney disease, COPD, hypertension, arrhythmias, and more. We're going to talk about labs, medications, fluids and electrolytes, assessments, clinical scenarios, and we're going to take those intimidating medical concepts and break them down into something you could actually picture and understand. Sometimes I may even explain something in a way that sounds almost too simple, and that's intentional. Because once you understand the simple version, then we can add the details. We're also going to be talking about test taking, because nursing exams have a special talent